Dr. Douglas Bettcher from the World Health Organization. Please give him a warm hand.
Good morning. It's great to be here in this magnificent venue. That was a good way to start our discussions this morning with a discussion by the kids of the opportunities and some of the challenges. Yes, I do eat my broccoli as well too. Healthy food is extremely important. So good morning, distinguished colleagues, and special thanks to the Uppsala Health Summit for organizing and specifying that ending childhood obesity and presenting the Ending Childhood Obesity report would be a priority for this particular summit. The background materials and preparations for the summit are really excellent, and I think the deliberations here will certainly help to move the global community and the pressing conversation on how to address childhood obesity towards more focused action. It's all about changing gears now towards focused action on the ground. Thanks to the leadership of our Director General, Dr. Chan of the World Health Organization, and the hard work and excellent contributions of the members of the WHO Commission on Ending Childhood Obesity, the world community, I think, is in a much better place today to translate the recommendations of the Commission into real high-impact policies and to really ground our future work and to create multi-sectoral and multi-dimensional technical packages based on the best scientific evidence. So just to create the foundations of the Childhood Obesity Commission's work, certainly the gravity and urgency of addressing the mounting millions of overweight and obese children cannot be overstated. New figures released from WHO recently indicate that there are 42 million children under the age of 5 who are overweight or obese. We know that the prevalence increases as children enter school, and also that this is an increasing problem in low and middle income countries. We know that childhood obesity undermines the physical, social, and psychological well-being of children. We know that also as countries undergo rapid socioeconomic transition, they face a double burden of undernutrition, malnutrition, inadequate nutrition, and also at the same time excess weight coexist together. Undernutrition in early life places children at especially high risk of developing obesity in later life when diet and physical activities change. So the background on the creation of the ECHO Commission, as we call it. 2 years ago, the Director General, a little over 2 years ago, decided that this pressing issue warranted a high-level commission to end childhood obesity, to review the evidence built on existing mandates and strategies, also to provide policy recommendations to governments that would help to reach the targets that have been set by the 194 member states of WHO of the world. For example, for underage 5 children, no increase in child overweight by 2025, and for adolescents and adults to halt the rise of obesity by 2025. And we know that we are not reaching those targets almost anywhere in the world. The work of the Commission was a colossal task. To this end, the Commission spent 18 months developing the report. They reviewed cutting-edge scientific evidence. They had extensive consultation with 118 member states throughout the 6 regions of WHO. They traveled extensively. They reviewed 179 comments through online serial online submissions and web-based consultations to come to the final report. So the Commission noted overall that no single intervention can halt the rise of childhood obesity, and that action needs to be taken to address the obesogenic environment as well as at critical points during the life course. By preventing childhood obesity, we'll not only be able to reduce the risk and morbidity and premature mortality of NCDs, but also reduce the risk of obesity in the next generation, and also to improve the health and well-being of this generation of children. The report details recommendations under 3 strategic objectives, 3 headings, namely tackling the obesogenic environment, reducing the risk of obesity by addressing critical elements in the life course, and treating children who are already obese, other words, weight management. And I'll just go through these in the next few slides, and I'll parse out some of the key recommendations the Commission made. So under promoting the intake of healthy foods and reducing the intake of unhealthy foods, addressing the obesogenic environment, certainly nutrition information needs to be easily understood and accessible to the entire population. The Commission noted with disappointment the poor progress of our countries on implementation of the set of recommendations on marketing of foods and non-alcoholic beverages to children since the recommendations were adopted by our World Health Assembly in 2010. Knowledge about healthy food choices cannot be acted upon unless these are locally available and affordable. And to those ends, the Commission recommended a tax on sugar-sweetened beverages. In fact, today WHO is releasing a monograph and communication materials providing the latest groundbreaking evidence on sugar-sweetened beverage taxes, recommending front-to-pack labeling, and also increase to healthy foods and subsidies for healthier foods to make them more affordable. So promoting physical activity is absolutely key, as we heard on the video this morning. Implementing comprehensive programs that promote physical activity and reduce sedentary behaviors in children and adolescents. Globally, it's a fact that over 80% of adolescents aged 11 to 17 are insufficiently active, according to the indicator of WHO, not attaining at least 60 minutes of moderate to vigorous physical activity as recommended by WHO on a daily basis. Physical activity can reduce the risk of cardiovascular diseases, type 2 diabetes, and cancer. Preconception and pregnancy. The Commission recommended at this crucial stage of development that countries should ensure integration and strengthening and guidance for non-communicable disease prevention with current guidance for preconception and antenatal care to reduce the risk of childhood obesity. Evidence shows that maternal undernutrition, whether that's global or nutrient-specific, maternal overweight or obesity, excess pregnancy weight gain, maternal hyperglycemia, including gestational diabetes, smoking or exposure to toxins can increase the risk of obesity during infancy or childhood. Also, the Commission under early childhood diet and physical activity, providing guidance on support for healthy diet, sleep, physical activity in early childhood to ensure growth, that children grow appropriately and develop healthy habits is absolutely key. Most importantly is protecting and promoting exclusive support for breastfeeding in early childhood, implementing the International Code on Breast Milk Substitutes, and also to encourage intake of a variety of healthy complementary foods rather than unhealthy, energy-dense, nutrient-poor, and sugar-sweetened beverages during this critical period of growth and development. Then, looking at school-aged children, the Commission provides a number of different recommendations, interventions to implement comprehensive programs that promote healthy school environments, health and nutrition literacy, physical activity among school-aged children and adolescents, emphasizing a life course education program in schools should be constructed along with teachers and should be embedded as a core subject rather than being something hanging out there as an optional an option. It must be in the core educational curriculum. Then weight management for those that are already overweight or children that are already overweight and obese. It's imperative that countries provide and services are provided through family-based multi-component lifestyle weight management services for children and young people who are obese or overweight. Less experience is certainly the case in and evidence how to do this in low and middle income countries. This is a distinct challenge moving forward. We also need to strongly advocate for this intervention to be an integral component of universal health care, which it's not even in high income countries. How can the ECHO recommendations, report contributes, and implementation of the ECHO contribute to other programs? It's clear, as I said, that no single intervention will be effective in tackling childhood obesity, and a comprehensive package is needed that will simultaneously address the environmental, behavioral, and biological determinants. In doing so, ECHO will contribute to other program targets, for example, as shown on this slide, action to improve breastfeeding rates, maternal and child health, adolescent health, well-being, long-term NCD prevention, and certainly a number of these are included in the newly adopted UN Sustainable Development Goals, so ECHO will be a key driver to attain the UN Sustainable Development Goal targets. So rounding out the conversation, what's next, what's around the corner? Our World Health Assembly, our governing body, the health parliament of the quasi-health parliament of the world, reviewed the ECHO report, endorsed it, and invited all relevant stakeholders to be involved in action on the ground, recommending that member states develop national responses, and immediately that the Director General of WHO should, in consultation with member states and consultation with stakeholders like you, very important, should create and transition the ECHO report into an implementation action plan that can be immediately prioritized on the ground in countries. The implementation plan, the draft implementation plan, details steps to be taken by member states to be put into action, recommendations, builds on existing activities. It groups recommendations to ensure comprehensive action in each domain. The draft is currently open for consultation, and it's very important that the outputs of this summit contribute to the review of the draft and its revision before it's submitted to the executive board. And we've already discussed with the organizers and are ready to receive your inputs as we put the finishing touches on by the end of this month to submit for the first time to our executive board for future deliberation. The action framework, it places an emphasis on the in the plan. It proposes an action framework based on the ECHO Commission recommendations. It's clear that we need leadership and capacity building to support interventions, especially in low middle income countries. Monitoring and accountability is key to ensure effective action. The status quo will not do. We need NGOs, civil society, non-state actors to hold governments accountable to the commitments that they've made. The actions needed, in a nutshell, that are highlighted in the action plan, the draft action plan: leadership for comprehensive, integrated, multi-sectoral action; interventions clustered around the three areas highlighted in the ECHO Commission report: improving food and physical activity environment, reducing risk of obesity through the life course, and improving current and future health of children and the management of their obesity. Monitoring and accountability for effective progress is going to be very, very, very important to make sure that countries are truly walking the talk and not just talking. Key elements for successful implementation, we need to have strong evaluation plans. Finally, government leadership and strong political commitment are essential for effective implementation. We heard from my colleague Sanya Nistor this morning that we need to be innovative and bold to bring together all sectors of government to society, and that's easier said than done, we realize, to give children a chance to thrive, make the most of educational opportunities, to be able to grow healthy and reach their full potential, and to be healthy parents for the next generation. The time for urgent actions in closing is now. There's no time for delay. The urgency has definitely been emphasized in the documents and convening this meeting. Major steps have been taken in recent years to put together the pieces of the jigsaw puzzle, to put together a culturally adaptable, multi-sectoral, multi-dimensional technical package. We're not there yet, but we're on the way. This technical package is essential to take on the daunting public health challenge of bending the trends of childhood obesity, which over the last 20, 30 years have been relentlessly upwards. So thank you again to the Uppsala Summit for prioritizing this urgent public health priority today on World Obesity Day. If you would like to have more information about our work and the next steps on the implementation plan, I've listed the names of the three program directors. The three programs are responsible and we are working together closely, myself or Francesco Branco or Dr. Costello at WHO. Thank you very much.
Thank you. Stay. Just one short question for you. You've been spending a lot of time on these issues. What do you personally think? When do you think we could reach the goal of no rise?
No rise.
Yeah, that's the goal, right?
Right. First, we've got to, political commitment's going to be necessary, but we're also going to have to put together a technical package of the evidence-based interventions, which we know are tested and work. We don't yet have that technical package. We have pieces of it for addressing the obesogenic environment. Those are listed in the plan. We have pieces of the puzzle for dealing with obesity over the life course. Management of existing obese and overweight children is a problem. I would make the analogy, because the first part of my career at WHO was in fact taking on the tobacco epidemic. And I was in fact the coordinator for the negotiation of WHO's first treaty, the WHO Framework Convention on Tobacco Control.
How long did that take?
So 10 years to negotiate and get into force. We're in the 10 years, entry into force was 2005. But thanks to the solid bringing together stakeholders, bringing together academia, bringing together countries of the world, putting together a sound framework, which is in this case legally binding, WHO has adapted with partners like Bloomberg Philanthropies, the Gates Foundation, countries, a package which we call Empower, which is basically those key evidence-based measures that we know work if they are implemented at the highest level, completely banning smoking in public places, high taxes and prices, et cetera, et cetera. We've seen, if you do those at the highest level, we know that you can have dramatic reductions. We're on the way to do this, and I feel that we're at a historical juncture. In fact, I feel somewhat nostalgic in a sense that this feels a bit like the late 90s. As we were increasing, mobilizing greater leadership, et cetera, we're putting together the necessary stakeholders, motivating the political support, but we're not entirely there yet with the whole package. And
I have to be the tough reporter here. What do you could you give us an estimate, best case estimate? 2050, no rise?
Well, I think we want to be seeing progress towards reaching these targets of 2025, of halting the rise of obesity. I think that's pretty ambitious, but I think we should be well on the way by then.
Yeah. Let's do it. Thank you, Douglas.
Good. Thank you very much.